Welcome back to Beyond the Heart. I'm your host, Dr. Nieca Goldberg, and we're here to talk about something really, really interesting and exciting, and it's called the Artifical Pancreas Project. And joining me in the studio is Derek Rapp. He's president and CEO of the Juvenile Diabetes Research Foundation, or JDRF, and he's a father of a child with type 1 diabetes, and Aaron Kowalski, who's an internationally recognized expert in diabetes technologies, vice president of the JDRF's Artifical Pancreas Project, and you were diagnosed as a teen with type 1 diabetes. So I think this is really exciting that you're here to join me on the show, and I'm going to start off with Derek. Tell us about your son's experience. Like, how old was your son when he was diagnosed?
Certainly. Good morning.
Good morning.
Turner is our son. He is 20 now. In 16 days, actually, it will be his 10th anniversary of having been diagnosed. As a parent, you know that date precisely.
That's right, because a very long time ago, we often weren't able to say that. So is your son a college student?
He is. He's a junior upstate at Colgate University. I'm pleased to say he'll be in town this weekend to run the New York Marathon, actually.
That's great. It's interesting. A patient of mine who happens to also have type 1 diabetes is running in the marathon this weekend.
Great.
Yeah, so when did you join JDRF?
I've been a volunteer with JDRF since 2005, and then I became CEO and president of the organization this summer.
Congratulations.
Thank you.
And, can you tell us about what the organization does?
Certainly. JDRF is the world's largest private funder of type 1 diabetes research.
Wow.
We have more than $500 million in active projects being funded right now by JDRF around the world. And in addition, we also work as advocates for people and their families with this disease.
It's a very, very important organization because, a lot of our listeners don't know how research is funded, and some of it is funded by the government and at the NIH, but their budget is limited, and organizations like yours really help a lot of researchers make a big difference in healthcare. So, Dr. Kowalski, can you just talk to us? People often listen to the shows and are familiar with diabetes, but there are two types of diabetes, and maybe you can tell us about it.
Sure. So JDRF, obviously, we're known as an organization that focuses on type 1 diabetes. But when you think about the differences in the two types of diabetes, type 1, or used to be known as juvenile onset, is an autoimmune disease. The cells that make insulin in your pancreas are killed by your immune system for reasons that we're still trying to understand.
That's right.
It's a big area of focus of ours. And that leads to the need for insulin replacement. So if you know a person with type 1, you'll see them often doing shots, or some people, myself included, wear an insulin pump. Type 2 diabetes is a disease that, in a simple way, is insulin is not working properly. And the body, often but not always due to overweight or obesity, and the body doesn't utilize the insulin that's needed, and insulin controls blood sugar. So both diseases lead to the same end result, which is high blood sugar.
That's right.
And as a cardiologist, high blood sugar is bad for the body. It causes diabetes complications such as blindness, kidney disease, and cardiovascular disease.
That's right. And, it's exciting to hear about your work in technology, because since type 1 diabetes affects young people, and even before insulin pumps, which was revolutionary because we had a lot of young people having to give themselves injections, they really, had a hard time with that. And in the very beginning, before insulin was invented, these people died. And because I was reading a book, we once had a guest talking a book about one of the first patients who used insulin, and they just didn't know what to expect. So tell us what that was like growing up.
So it's interesting. Growing up, I also have a brother who was diagnosed in the late 70s. He's a few years younger than me. When we used to do 2 shots a day and take urine glucose measurements. And today, both of us wear insulin pumps, tremendously helpful. We both use continuous glucose monitors. So you imagine, again, people who know folks who have diabetes would stick their fingers to draw blood. Now we can do continuous measurement by wearing a patch-like device on our arms or abdomens that give real-time glucose information. And these technologies, ultimately, we are trying to do two things. One, keep people healthy. JDRF is focused on curing type 1 diabetes,
Absolutely.
but in the meantime, we want people to be healthy and ease some of the burden of the disease. It's a 24-hour-a-day, 7-day a week, 365-day-a-year job, really. And I was on the phone with one of our volunteers yesterday, and it just really brought it home for me, even having lived with this. She was talking about having brand new twins and
Yes.
how much more difficult it is with her 11-year-old son because she's waking up multiple times every
That's
night
right.
to test his blood sugar. So the technologies that are evolving towards an artificial pancreas, which would be automated insulin delivery, will do both of that for us. Help reduce the risk of highs and lows, and also make life easier for
So
people
I
with
want to
diabetes.
just say high and low blood sugars for our listeners.
Right.
So tell us about this artificial pancreas. And before you do, I just want to let our listeners who are just joining know about our guest today. We're in the studio. We're talking with Derek Rapp, President and CEO of the Juvenile Diabetes Foundation, or JDRF. He's also the father of a child with type 1 diabetes, and Aaron Kowalski, an internationally recognized expert in diabetes technology, vice president of the JDRF's Artificial Pancreas Project, and he was diagnosed as a teen with type 1 diabetes. We're also taking your calls if you have questions about JDRF or type 1 diabetes, some of the new technologies. Give us a call at 877-NYU-DOCS, 877-698-3627. And, of course, if you're shy, you can call us at docs@SIRIUSXM.com. So tell us about, this Artificial Pancreas Project and what is an artificial pancreas.
So the first artificial pancreas systems will be automated insulin pumps. Right now, people with diabetes need to take all the different information that they have in their lives in terms of their blood sugar, their activity, it could be hormone stress, and try to make decisions with insulin that normalize blood sugar levels. And the data from studies, many studies, shows that that's very, very difficult. Even people who test upwards of 10 times a day still only spend about 30% of the day in the normal blood sugar range.
Okay.
So it's hard. And
Even with the people who are most vigilant.
most vigilant, wearing pumps, even wearing continuous glucose monitors. So what we're trying to do is add very smart software, what we call computer algorithms, into these pumps that take the glucose information and automatically make those decisions based upon physiologic models of diabetes. And the research that JDRF has funded has shown that this works. It works very well. You can tremendously reduce high blood sugar, what causes complications.
That's right.
And simultaneously reduce the risk of low blood sugar. And for folks who don't appreciate type 1 diabetes or diabetes and taking insulin, insulin's one of the most dangerous drugs because too much insulin at the wrong time can cause severe hypoglycemia, which can lead to people passing out,
Shock.
seizures, and even death. So that balance is very fine, and these artificial pancreas systems and research studies are tremendously improving glucose balance.
So how far are we along in being able to have a person use this device?
So the first systems are already becoming commercially available or are being tested at FDA, and those systems deal with the low blood sugar side of the equation. The first systems that start to reduce high blood sugars, JDRF is funding studies in the United States. Oh, I'm sorry.
Yeah, so Derek, I mean, this is a lot of funding. How much has this research project cost?
Aaron
Oh,
can say
Aaron.
perhaps
This
better.
is almost over $100 million that we
Wow.
funded in this area
just
alone.
specifically in that project.
It's amazing. I want to know. So with this this artificial pancreas, so this newer device, how is it? How do people wear it? Is it implanted under the skin?
So this would be an external device.
An
So
external
it's
device.
taking an insulin pump, which is the size of a pager, worn in. I wear one in my pocket, in my pants, and adding smart software to automate the insulin
Wow.
delivery.
That's really interesting. So the first rollout, which would be dealing with the lower blood sugar, will be soon?
So the devices have been approved in Europe and are in testing here in the United States.
And in fact, the first step of that happened at this point close to a year and a half or something?
Yeah, about a year and a half ago, what we call low glucose suspend system to try to prevent very severe lows.
So what do you think this could mean for people with type 1 diabetes, Derek?
It's peace of mind in so many ways, both for the people with the disease and, again, their parents, their loved ones. The idea of being able to go to sleep and know that you're going to be woken up if the blood sugar passes out of the range, but most likely the device is going to keep it in range in the first place. As a parent, I can say that I've set my alarm. My wife and I set our alarm at least hundreds of times to check our son, and that's typical. You know,
and everyone hears that someone with type 1 diabetes is going to run the marathon, but I don't think they understand how much more difficult that is for a person with type 1 diabetes than someone without, not in terms of managing, right, Aaron, managing the sugar, running the race.
I've run, this will be my 5th New York City Marathon this year. I'm actually walking it with my parents, but I've run 4, and it's amazing the work and challenges, particularly trying to avoid a low blood sugar, which can be debilitating. So the technologies have been incredibly helpful. I wear the pump and the sensor in a little fanny pack when I run, and it's really allowed me to do it. Before, I wouldn't have the confidence.
So, and you also have to take snacks along?
I know. Sure. I actually have 3 belts on when I run the race.
I was going to ask. You have
it's harder. And one thing I always tell parents, though, and I think it's important, is living with diabetes comes with these extra challenges, but you can do things and not be limited. And I was really proud. I ran a Boston qualifying time a few years ago in New York. So it takes a lot of work, and it's a lot harder, but you can still do amazing things, and that's an important message
you certainly
to the listeners.
And notice that Aaron mentioned the fact that he wears a continuous glucose monitor. Turner will also. He does anyway, but he certainly will in the race. Okay. That is a critical safety factor for sure.